Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. All right, hello everybody, and welcome to Daily with Doc. Let's go ahead and open up that waiting room as we are live. So if you are joining us live, hello and welcome. I see some of my favorite people there. Just want to say hello and hope you're having a fantastic day as we are going to be bringing some more information from the man himself on what we can do to open up our heart's potential and support cardiovascular health. So I hope you guys are all ready, as that is one of the top things that is a major health concern around the world, especially here in the United States, but it is around the world. So my name is Becca Dukes. Hello and welcome to Daily with Doc and Becca. This program is being sponsored by dailywithdoc.com. On our website, you will find more information about us. You can sign up for our email list so that you don't miss a beat, and you get reminders of when shows are happening, and then also what shows have been in the past so that you can easily search for them and find them to share. And the nice thing about having email is it's so easy to share that people can then have it in their email, look at it on a bigger screen than the telephone, and learn. So share, everybody. But most importantly, let us know where you are joining us from. If you're here in the live Zoom, you can put it in the chat. If you're out on any of the different platforms, please, if there's a way to comment, let us know you're there. So, and subscribe. Make sure that you're subscribed to our channel so that you get those notifications of when we do go live and when we post additional information to help you on this health journey. So as the Director of Student Services for the Institute of Holistic Health, it is my honor and privilege to bring this show to you. And on this day, we have with us the leader, the man that started this crusade, the one who has discovered that there's 90 essential nutrients. There's actually 91. We just round it to 90 to make it easy to remember. And he has done so much in his lifetime. Dr. Joel Wallach is a renowned figure in the field of veterinary medicine, naturopathy, and nutritional sciences. He holds a Bachelor of Science in Agriculture, both plant and soil sciences. He is a Doctor of Veterinary Medicine and a Doctor of Naturopath, and he has 3 postdoctoral degrees in pathology. Dr. Wallach is best known for his research and advocacy for the use of nutritional supplements to prevent and treat chronic diseases. He's gained national prominence through his influential audio tape, Dead Doctors Don't Lie, which presented his theory that many chronic diseases are caused by nutritional deficiencies. Dr. Wallach has been a vocal critic of this FDA's regulatory system regarding nutritional supplements, and he has been involved in legal battles and won against the FDA, notably his fight to have specific essential nutrients included in baby formulas, prenatal vitamins, and to allow the public to be informed about the health benefits of nutrients. Dr. Wallach's work is significantly impacted the liquid vitamin and mineral supplement market. He is a strong proponent of the role of epigenetics, as he is one of the founding fathers of the science of epigenetics, where how environmental factors, including nutrition, folks, can influence gene expression without altering your underlying DNA. Dr. Wallach emphasizes that providing the body with the necessary nutrients, you can optimize gene expression and support optimal health. It is with great honor and privilege to be able to bring to the screen with me my mentor, Dr. Joel Wallach. Dr. Wallach, hello, and how are you today?
Well, thank you for the kind introduction, Rebecca. Thank you, team. And I always enjoy getting on the show. I'm so busy, but I'd like to, as I'm getting older here, I'd like to do more shows and less busy. But I see through various means, I see thousands of patients a day in over 80 countries, and it's really a blessing to be able to help so many people. And I appreciate each and every one of you, because each and every one of you help make all this possible. Thank you, thank you, thank you. Well, today I want to talk about the heart and its associated diseases. And the heart, and of course the arteries and veins are required. Okay, they work 24 hours a day for your entire life. Okay, and it's very, very important. And right now, you have to appreciate that heart disease in America alone, we spend each year just to treat, not to prevent or cure, but just to treat the symptoms of heart disease, we spend $316.8 billion. To treat, not to prevent or cure it, but just to treat the symptoms of high blood pressure, we spend $131 billion. So that's $7.8 billion we're spending for heart disease and blood pressure issues. Okay, and it's one of those things where we got to throw the kidneys in there. That's $24 billion for the kidneys. Why the kidneys? Because when the kidneys arteries get blocked, you get high blood pressure. Okay, they're associated with high blood pressure and blood flow and all that kind of stuff. Okay, and let's see here. Also, diabetes is associated in this. We spend $342 billion a year just to treat the symptoms of diabetes, type 2 diabetes. Just type 2 diabetes, we spend $342 billion a year just to treat the symptoms, not to prevent or cure it. All these are preventable and reversible because none of them are genetics. They're all just nutritional deficiencies. There are no genetically transmitted diseases. Doctors invented that when they didn't know the answer to the question. They didn't want to say, we don't know. Oh, you have 3 people in your family with the same disease. That means it's genetic. No, that just means they're all eating grandma's recipe. Okay, they're all getting the same deficiencies. It's one of those things where this is really quite simple. Okay, and so this is why we have the programs that we have, and this is why our books are so valuable. And of course, we do have a educational brochure. It covers about, I don't know, 20 or 25 of my books. But yeah, I think we have 20.
I'll hold it up for you, Doc.
Okay, thank you. There you go. And of course, open it up. You see we have pictures of about 20 of my books. And there's a couple of paragraphs on each one, tells you what's in them. Go ahead and close that now and let me see the back page. Okay, the back page goes into my CDs and DVDs and videos. Okay, and there's about 100 of those on the back page there. And of course, it has my flip charts on the back also. And so this is, we're trying to get the information out there. Okay, well, there's the flip charts. You may have one of the older ones that don't have the flip charts on there.
I was going to say, I'm not seeing the flip chart, but I've got it right here, Doc.
Oh, there you go. You got one. Okay. Oh. And so, yeah, it goes into some of the most famous people in movies and sports and medicine and industry. And we had their pictures, we had the diseases they had and what we gave them and how they got better and so forth. The flip chart is very useful because you can show that to a couple of your relatives or friends or new associates in your kitchen. You can, in your den, you can show it to maybe 5 or 10. A school meeting room, you can show it to 30 to 50 people. And then auditorium, you can show it to 100 to 1,000 people. Okay, and stadiums, you can show it to 3,000 people. Okay, by using all the equipment to get that stuff that's in the
Yeah, you definitely want to use a projector, wouldn't you? To be able to show that many,
okay.
for sure.
Okay, well, heart disease, obviously, since the heart is necessary of our life, you want to make sure there's away from the bad foods. Okay, you want to stay away from fried foods. You want to stay away from processed meats. You want to stay away from sugar. You want to stay away from carbonated drinks. Even the diet ones got to go. Carbonation neutralizes the stomach acids, so you cannot efficiently digest food or absorb minerals. And of course, there's one soft drink. Okay, Dr. Pepper. There's just a recent story about a gal who was drinking it every day of her adult life, Dr. Pepper, and she lived to be 104. Okay, now Dr. Pepper is made from water. It comes as the water is highly, what should I say, heavily invested with minerals because of the location. Also, they put all these herbs in there. That's why they call it Dr. Pepper. Okay, and so
I'm going to add to your story when you're done to it, though. And it's about the diet, Dr. Pepper of it. Go ahead. Sorry.
Okay. And then, of course, we also have the book, Let's Play Herbal Doctor. It gives you the same information of Let's Play Doctor, but instead of talking about vitamins and minerals, Herbal Doctor talks about herbs, as the title implies. So we have whatever way you like to approach things, we have the ability to help you get there. Okay, so very proud of that. Yeah.
So before you move on, Dr. Wallach, I just want to add, because I'm not a proponent of Dr. Pepper or any sodas or any carbonations, especially when they have artificial sweeteners that have been found to be cancer causers. In fact, my mom and my aunts all drank Dr. Pepper, Dr. Wallach. Well, 3 of the 5 all got brain tumors. My mom's the only one that survived. So I don't want to promote Dr. Pepper.
Okay, but yeah, I'm not promoting Dr.
You have
Pepper.
You have a better drink to promote than Dr. Pepper.
Yeah, we got Rebound.
That's right. That's right.
We got Rebound. Okay. And so basically, what I want to remind everybody is that we have to really make sure that we're taking care of the heart. So we came up with the Healthy Brain and Heart Pack, which is the basic 90 essential nutrients, 60 minerals, 16 vitamins, 12 minerals, 3 fatty acids, all of which are absolutely necessary for heart function, heart health, and heart longevity. Okay. And so I would also add to that the Healthy Brain and Heart Pack, the glucogel, because the valves in the heart are made out of the same stuff that the cartilage in your knees are made out of and the tendons in your legs are made out of. Okay. So you need the glucogel to add to the, I'm the guy who came up with glucogel. Okay. Because it was one of those things where people were using what? They would boil bones, okay, bone broth. And for thousands of years, they're boiling bones, and they would drink that the next day and get the minerals that way. And people, after in the modern time, people got sick and tired of stinking up the house and getting burned and boiling bones. So I came up with glucogel, and essentially for athletes, for Theo Ratliff and boxers and football players and so forth, the glucogel. And anything that's made out of connective tissue, including your heart valves, will love glucogel. Okay. And it's just one of those. I take 3 of those. I only weigh 142 pounds. I take 3 of those twice a day, the glucogel with everything else I take. And then let's see here. We also have to talk about the kidneys and the heart and the high blood pressure. Well, what's the kidneys got to do with high blood pressure? Well, the kidneys, all the arteries and veins bring the blood to the kidneys so the kidneys can filter the blood. Okay. And if the arteries and kidneys, if the arteries and veins in the kidneys are blocked, okay, and have all kinds of diseases, the kidneys can't do their job. Okay, and they want to do dialysis, okay, once every week or every 2 weeks, whatever it is, so that they can also do kidney transplants. Well, I like to do it the other way. Okay, I like to rebuild the kidneys, so we have what we call the Ultimate Daily Classic tablets, and it will help blood flow into the brain, into the heart, into the kidneys, into the liver, into the lungs, into your muscles, into your bones. Okay, and people don't realize how valuable your kidneys are when it comes to high blood pressure, and it doesn't make sense we allow that to happen. All these various surgical issues and drug sales, we're talking trillions of dollars each year, when really you just give the nutrition to the kidneys and keep the bad stuff away from the kidneys, and you'll add many healthful years to your life and get rid of all the misery and all the mess, that you have to go through to get, all of the various treatments that they want to give you when you have, quote, kidney issues, unquote. Okay. And so this is something that's all in the book, The Wallach Revolution. Okay. It's in the book, The Wallach Revolution. Epigenetics, which mentioned epigenetics. Okay. I'm one of the founding fathers of this. Okay. It's 500 pages. It covers most of the diseases that, there you go, thank you. Most of the diseases that doctors want you to believe are genetic, okay? And there are no genetically transmitted diseases. The only thing that genetics are involved in is eye color, hair color, skin color, and oh yeah, it tells you if you're a boy or girl. That's genetics, that's it. Nothing else is genetic. And so, what?
Your height, does that have anything to do with genetics? How tall you are?
You broke up. I didn't hear what you said.
How about your height? How tall you are? Does that have anything to do with genetics?
No, it has to do with what you eat and what you don't eat. If you eat gluten, okay, and the villi in your intestines go away, you lose about 80% of your absorptive surface. Even if you're supplementing, you're not going to get much. And if you're only getting 25% of your nutrition, you're going to be 4 foot tall instead of 6 foot tall. Okay.
Okay, so genetics. Okay.
Now, human.
All right, because I know somebody that's 6'10", Dr. Wallach.
Yeah, there's basketball players out there that are 7'10", okay, and so yeah, no, this is the newspapers. This guy.
I'm not arguing with you. Okay. I'm just thinking all of the people in my family are very tall.
Mm-hmm. Okay, did they all live in the same county?
No. We're all over the United States. So all of my cousins are like 6'3", 6'4", up to 6'10". So I was just wondering about that being genetic.
Well, genetic for height is a limit. Okay, there's not going to be a person who's 20 foot tall, like a giraffe. Okay.
Right.
Giraffes can be 20 foot tall, but we can't be 20 foot tall because we're limited by genetics how tall we can be.
Okay, so genetics does have something to do with it, or is it the species?
Well, genetics, when it comes to your height, gives you an upper limit.
Okay, all right.
Your age, it gives you an upper limit.
All right, thank you, Doc.
Okay, and so then you need, again, the Ultimate Daily Classic tablets. I take 3 of those twice a day. Get the kidneys happy, get the blood flowing through all the blood vessels in the kidneys. It maintains your blood pressure, blood flow to all the organs and everything. And let's see here. Oh, The other thing that people talk about is cholesterol. They think cholesterol is the most terrible thing on earth because it plugs the arteries. Oh my gosh. No, cholesterol is your best friend. Cholesterol is your best friend. It makes sex hormones. Okay. Also, cholesterol makes up 85% of your brain weight. The myelin, the white matter of the brain, is made from cholesterol, and 95% of the weight of your spinal cord is cholesterol. You do not want to block cholesterol. You do not want to take drugs to block cholesterol. When a doctor writes you a prescription to take a drug to block cholesterol because you have some elevated cholesterol, well, you need to find a new doctor. That's why we came up with a flip chart, because we have all these famous people, okay, who had these problems, okay, and the doctors were blaming it on cholesterol. No, it was due to eating gluten and not taking the 90 essential nutrients. And that's why we came up with I-26. You come up with the I-26, and it rebuilds the myelin in the brain, rebuilds the myelin in the spinal cord, and gives your sexual organs, whether you're a boy or girl, the raw material they need to make the hormones. Your hormones are made from cholesterol. So if you're blocking cholesterol, there ain't nobody home anymore. You do not want to block cholesterol. Okay, you want cholesterol. You just don't want to fry it. You don't want to burn it. You don't want to cook it really, really bad. And so just heating it just mildly is safe. But when you fry cholesterol, you turn it into something bad.
They get the trans fat. So Dr. Wallach, what is clogging arteries then, if it's not the cholesterol?
Okay, blocked arteries is caused by the bad stuff that comes from fried foods, eating gluten. Okay, it's fried foods and gluten is what blocks arteries.
Does sugar play into that also?
No, sugar is a, what should I say? You find it in apples, you find it in bananas, you find it in peaches.
About refined. So I guess I should have been more clear about refined sugar, the stuff that's really going to affect your
sugar. Refined sugar, as long as they don't put anything else in there, is still just sugar. Refined sugar, they're just getting any little bits of apple out of it and that kind of stuff. And so you look around the world and you see the people who live the longest. Okay, the Hunzas in the Himalayan mountains in Pakistan, they're the longest lived people on earth. They don't even have a single medical doctor. I repeat that, they don't have a single medical doctor, and yet their average lifespan is 122. We have the top doctors in the world, and our lifespan is 75.7 right now. Okay, doctors in the emergency room, their average lifespan is, I think it's 54.7. That's because all they do is drink soft drinks and fried foods and all that kind of stuff, because they're up 24 hours a day. And so they eat crud food and bad cooking, and they pay the price. They have a short, ugly, miserable, lonely life.
Or it's short and quick, because a Widowmaker takes you quick, Dr. Wallach, if you don't survive it, right?
That's right. Okay. And so at any rate, if you take your 90 essential nutrients, okay, the Healthy Brain and Heart Pack, and if you have something going on, you want to get the book, Dead Doctors Don't Lie. You want to get the book, Let's Play Doctor. There you go. You want to get the book, Epigenetics. You want to get a hold of the book with the Wallach Revolution. There you go. And it'll walk you through what to do for all these diseases, okay? And so this is very simple. I'm 85 years old using the Chinese method of aging. The Chinese give you credit for the time you're in the uterus. So from the time you're conceived and the sperm fertilizes the egg until the time you're born is usually on the average around 9 months. So the Chinese say when you're born, you're already 9 months old. In America, they say, oh, your birth date is on such and such a date, and you start at 0. They don't give you credit in America for the 9 months you grew from 2 cells into a living, breathing, functioning human being. I'll take the Chinese way. I'll take that 9 years, or 9 months, excuse me, 9 months. I'll take the 9 months, okay, when I was born. And so if I'd be 84 and a half if I didn't count the 9 months.
Right. Well, Dr. Wallach, there's one more thing that I want to bring up in regards to your publications, and that's something that Yvonne, thank you so much, Yvonne, brought up out on YouTube. You have a flash drive, and it's kind of lost on this particular educational brochure, but the flash drive has so many of your recordings, your lectures on it. So instead of having individual CDs, folks, you can get the majority of them on a flash drive. And it makes it easy to take with you. Plug it into the computer with a USB port, and there you go. So I just want to make sure people know that that is available, since we are using more of the more modern technology, Dr. Wallach.
We do.
And you can get all of Dr. Wallach's publications by calling Wellness Publications at 800-755-4656. Again, that's 800-755-4656.
And also we have the DVD. Okay, it's one of my newer DVDs. Okay, and it's 2 hours and 10 minutes long. It's one of the best lectures I've given. Okay, it was in a big auditorium, great equipment, and it was recorded.
Go ahead and put it, Doc, you're muffled. Go ahead and put it down. So yeah, now you're between your microphone. So Dr. Wallach, no, go ahead and just put it down, Doc. Close it. Show us the front cover.
Okay.
So yeah, that is one of the greatest lectures, Dr. Wallach, and it was captured and put on a DVD for all of us to be able to enjoy for years and years to come. That's fantastic. And what's the name of it?
Dead Doctors Don't Lie. The subtitle is Someone Should Go to Jail.
Yes. And why do you have that subtitle?
Well, because this information is known. And of course, when you look at, again, type 2 diabetes, we spend $342 billion a year just to treat the symptoms of type 2 diabetes, not to prevent or cure it. Heart disease, we spend $316.8 billion just to treat the symptoms, not to prevent or cure it. Arthritis, we spend $626.8 billion just to treat the symptoms, not to prevent or cure it. Let's see here. Osteoporosis, we spend $6.7 trillion to treat osteoporosis, not to prevent or cure it. This is criminal because we know how to prevent these diseases and how to reverse them nutritionally for like 1/100th of the cost or 1/1000th of the cost.
Yeah. Well, there's a lot that we can do as individuals, isn't there, Dr. Wallach, without getting to the point where we have to have surgeries and those expensive treatments, procedures.
And people say, well, I have health insurance that pays for a lot of that. Well, we didn't need health insurance until 3 o'clock in the afternoon, Monday, September 4th, 1882, when Thomas Edison turned on the electricity. Thousands of years, we have been getting our minerals from the wood ashes and coal ashes, which we would put into the garden as fertilizer. The plants would suck them up. We would put the wood ashes and coal ashes in our food as a spice. And then when we went to electricity, we didn't have those sources of minerals anymore because we had electricity. Electricity has killed more people in all the wars that all the countries have been involved in since the beginning of time. Electricity has killed and injured and damaged more people. Now, when you think of that, you say, oh my gosh, I've never connected that. Okay, well, guess what? They cut off our mineral supply. And in the Bible, it was well known in the old Bible 2,000 years ago, the land flowing with milk and honey, where people lived a long time. You know, people lived to be 200, 300, 400, 500 in the old Bible. And they lived in the land flowing with milk and honey. Why was it the land flowing with milk and honey? Because it was at the base of a mountain and there was milk coming down from the side of the mountain. It was glacial milk because the glaciers were grinding up the rocks and the white powder. got into a stream coming down the side of the mountains, and so that stream turned white like milk. And they didn't know, because they didn't have all the equipment and all the science and so forth to test the glacial milk to see what it was and to see it was minerals. They just called it milk because it looked like milk.
Well, and you know, if that's what you know, then you really don't know, because you don't have the way to scientifically say what is in it or not whenever you don't have the equipment, right, Doc?
That's right. And of course, some glacial milks only have 4 minerals in it. Some glacial milks have 25 minerals. Some glacial milks have 50 minerals. Some glacial milks have 75 minerals. Okay, that's why we came up with the book, Rare Earth Forbidden Cures. Dr. Milan and I, we went to several different countries and that are listed in the old Bible as the land flowing with milk and honey. Okay, and people have the longest lifespans. And we had the soil analyzed. It wasn't already analyzed by their universities and their soil departments and so forth. We analyzed the soil, what minerals were in there at the base of the mountains. Okay, also, before we had electricity, we didn't have hydroelectric dams. Once we had hydroelectric dams, it cut off the silt and the flooding every spring, stopped that, which is on one hand a good thing, but on the other hand, it shut off again the supply of minerals. And plants only need 3 minerals. If you look at commercial fertilizer, it only has 3 minerals in it. And that's why we came up with the Healthy Brain and Heart Pack. Okay. And that's why we came up with the glucogel, so that we could get everything you need for healthy bones and joints and heart valves and that kind of stuff. Thank you.
Well, thank you, Dr. Wallach, for all that you do and have done. And, you know, there was an article written in a newsletter that's put out by a doctor. He's an MD, but he also has a naturopath that writes for him. And in October, they put out this article called Mighty Medicinal Minerals. And as you're reading through it, it's like, man, this guy's like right in line with Dr. Wallach. Well, they didn't give you any credit for it, Dr. Wallach. And one of our
medical doctor.
Well, the one that wrote it was actually a naturopath, but let me continue. So one of our distributors, one of our certified holistic health coaches, they received this newsletter, they read through it, and they immediately contacted the editor and told him, you know, Dr. Wallach is the one that's been saying this for years. He should get credit. And they did an editorial note that says that I had noted the article that there were 60 essential minerals, and it turns out that this was based on the individual research from another naturopathic physician, Dr. Joel Wallach, DVM, ND, who I had the privilege of being a fellow classmate in our naturopathic medical school training at the National University of Naturopathic Medicine in Portland, Oregon. I wish to give Dr. Wallach the credit he is due for his painstaking mineral research and numerous published papers on nutrition, including the 90 essential nutrient concept. Dr. Wallach has also formulated essential nutrient formulas containing the 60 essential minerals in a bioavailable form, patented as 90 for life. I regret this omission, and I hope Dr. Wallach continues researching the human need for essential minerals. John Sherman, ND.
Wow.
So I just wanted to throw that out there, Dr. Wallach, that, you know, your message is being shared, but we need to make sure that you're getting credit for it. And Gretchen, thank you so much for writing the editor of that newsletter and making sure that that happened in that publication. And Doc, that's why we do this show is, you know, you are the man behind all the research. You're the one that wrote the books. We need to make sure that you're getting some of the credit for it. Because a lot of them are saying it's all new discoveries. We've been saying this for decades.
Yes.
So, yeah. But I thought you'd get a kick out of that, as we definitely want to make sure that credit is given where credit is due. Well, folks, we have some more time. We've got some hands up, Dr. Wallach, with questions. We've got questions coming in from the different
let's have a few questions.
Yeah, we've got some questions, and TC is writing in a question. It's a technical issue. TC, for those technical issues in regards to the molecular length of the longevity collagen peptides, please email healthquestions@longevity.com. I don't want to just ignore your question because, I mean, there are a lot of people that want to go deep, and they need to go to healthquestions@dailywithdoc.com. They do have a nurse that fields that email address, making sure that the information is given directly from the corporate office.
Rebecca,
Yes,
you gave health questions at Daily with Doc.
for the technical question, that's correct.
No, health questions
has-
at longevity.com.
Thank you, Ruth Ellen.
You're welcome. Sorry to interrupt.
Healthquestions@longevity.com. Thank you. Thank you. Thank you. So yeah, Marilyn, she typed it right. Good job, Marilyn. So Dr. Wallach, let's go to a hand that is up. And just a reminder, folks, if somebody referred you to this program, make sure that you get back with them. Tell them thank you, because there is something within today's show, whether it's not for you, it's for somebody you know. And it can be life-changing, as it has been for so many of us. So first question is coming from Gail. Gail, can you go ahead and unmute yourself? And what question do you have for Dr. Wallach today?
Hi, thank you for taking my call. Hi, Dr. Wallach.
Hi, can you speak up just a little bit?
Sure. Can you hear me?
That's better. Thank you.
Okay, great. So I'm calling on behalf of my mom. She had a stroke 1 month ago. And they have her on, of course, they want to put her on a ton of medications. And we're trying to figure out what we can do to help her. She had no movement on the left side, but now she has her movement back. They went in and did surgery to take the stroke out. Or the clot. It was a 1/2 inch out of the right side of the brain. She has her speech. She's able to walk. She can dress herself. But she has really bad shaking in her hands. And they have her on amiodarone, and Eliquis, and they want to put her on a statin, which we've refused the statin because we don't agree. But they're pushing the statin again, saying that if her cholesterol is higher than 70, or her LDL is higher than 70, she has to be on one.
Okay, let's stop there.
Okay.
How old is she? How much does she weigh?
So she just turned 80 a week ago, and she weighs 168 pounds.
168 pounds. She's 80 something years old.
She just turned 80.
Just turned 80. Okay, 160 pounds. Okay. She probably has osteoporosis of the skull, squeezing the brain and the spinal cord.
Okay.
And the doctors are treating the symptoms with all these different drugs, and
Right.
that's typical of the medical system. They're treating the symptoms. Okay.
Yep.
So she needs to get rid of all the bad foods: no fried foods, no processed meats, no oils, no glutens, no wheat, no butter, no oats, no buckwheat, no sugar, no carbonated drinks. Even the diet one's got to go.
Yep.
Then at 150, 160 pounds, she needs 2 healthy brain and heart packs per month. 2 healthy brain and heart packs per month, a full dose of everything twice a day. She needs the I-26. I want her to have start out with the chewable. She can go to the capsules and the powder later. But the chewables, I take 3 of those twice a day. I only weigh 142. I take 3 of the chewables twice a day. The chewables are soft disc.
Okay.
They're about 1/2 millimeter, millimeter or centimeter, 1/2 centimeter thick. Okay. And the diameter is about that of a quarter. Okay. And so I take 2 or 3 of those twice a day. I like the French vanilla flavor, but they do come in banana coconut, and very, very soft chewables. And then, of course, the Healthy Brain and Heart Pack, the I-26, which you just mentioned, needs the, I would go with the Ultimate Daily Classic tablets, 3 of those twice a day. And they help the blood flow. Even if you have blocked arteries in the heart, the brain, the kidneys, the Ultimate Daily Classic tablets help with the blood flow and inflammation And so this is a way to get all things going there. And
Which-
don't forget, it wouldn't hurt to get some extra of the EFAs, essential fatty acids.
Okay.
Take 3 of those twice a day. That will help prevent blood clots.
Okay, great. She has lymphedema as well and lipedema. And I was wondering, is there anything else she can do that would help with that as well? She's not been able to clear
the
that
Ultimate
up.
Daily Classic tablets will help that.
The Ultimate Daily. Okay,
Yeah.
great. Okay.
Okay,
Okay.
give us a call every 10 days to 2 weeks and let us know how that person is doing, because they usually get very fast results.
Okay, great. Yeah, we're hoping to hopefully get things turned around. So, all right, great. Thank you so much.
You bet.
All right. Thank you so much, Gail, for calling in on behalf of your mom. Absolutely a great option that Dr. Wallach just gave you. One of the best options, maybe the best. Let's go over to Marilyn. Marilyn, go ahead and unmute yourself. What question do you have for Dr. Wallach today?
Yes, Dr. Wallach. If someone has eye issues, can liquid minerals be put directly in the eyes?
Okay. Directly in the eyes, I would start out with colloidal silver, the droppers, okay? There's no alcohol in it. It's not going to burn or anything like that, but it will kill any bacteria, viruses, fungus, or yeast in the eye, okay? But I would also treat this person for osteoporosis of the skull, squeezing the optic nerves, okay? Squeezing the optic nerves. It prevents information going from the brain to the eye and information from the eye going back to the brain. It actually restricts blood flow to the arteries into the eye and veins back to the brain and so forth. And so the approach when people have eye issues is to treat the optic nerve and the eye. And you do that, and we have Occutive. I take 3 of those twice a day, Occutive. They're little bitty capsules. And then I also take the Vision FX, also little capsules. I take 3 of those twice a day. And I'm, using the Chinese method of aging, I'm 85 years old. And most people think when they look at me, I'm in my 50s or 60s. They can't believe I'm 85. Okay. Well, that's because I'm giving my brain oxygen, blood vessels, blood, nutrition, taking all the bad stuff away. Okay. And so my brain is much, much younger than my chronological age.
One of my clients has a lot of fluid in her eye, a buildup of fluid in her left eye.
Well, what happens when you dam up the veins coming out of the eye? The fluid builds up in the eye because the artery is still pumping in there, okay, and the vein's been crushed, and so the eye is filling up with blood, okay? It's a mechanical thing.
One other product some people recommend, I'm just saying for in the eye directly, is Z-Radical. Is that possible?
Okay, Z-Radical for what?
Z-Radical directly in the eye, is that possible? Or should we just do the colloidal silver only?
I would just go, I would go with starting out with the colloidal silver. It's been used for over 400 years without a problem.
Okay, thank you.
All right. Thank you. Thank you, Marilyn. Did you have another question?
That's it. Thank you.
No. All right. Thank you. Thank you. And so, Dr. Wallach, I have done some conversations with the brand ambassadors of Z-Radical, and they do actually use it in the eye. I know you can't keep up with all the thousands of products that are offered through Longevity, but that is something that has been put directly on the skin, in the eye, and internally. So got some good nutrition going in there that helps to fortify the body and at the cellular level from the inside out, outside in.
I take it. It's one of those things where if you look at the table where I eat my meals and make my phone calls in my house, I have all these, I have 50 different products there, and I take 3 of those twice a day, of all 50 of those, and Z-Radical is one of them.
Yes, and the Fucoid Z. in the capsule form. So
Correct.
yeah, I mean, Doc, looking at your table, you would think you'd want nobody sitting with you to have a meal, but there's room. We always make room, right, Doc?
Yeah.
All right, let's go over to AJ. AJ, what question do you have for Dr. Wallach today?
Hey, Dr. Wallach, how's it going?
Okay, sir. How are you doing? Thank you for all the great things you do.
Oh, thank you, Doc. So, Lauren phoned in. He's got 5 kids that are athletes, and they're 6, 8, 10, 13, and 16. And we kind of went over using the Kids Toddy and the EFA Plus for the younger ones, and like the Healthy Body Start Pack for the 2 older ones. But the kids want to be tall basketball players. So he's wondering, can he use the HGH Youth Complex, or can he use the Rise and Restore, the new product? What should he do to maximize the growth potential of these kids?
All males?
One girl at 8 years old.
Okay. Well, the males can use the Zera test. The female can use Zerafem. Okay. It sort of stimulates the production of the hormones. Okay. And then they also need the glucogel for the tendons and ligaments and the disc between the vertebrae and all that kind of stuff. And let's see here, it wouldn't hurt again. The Ultimate Daily Classic tablets get the blood flowing through everything, including the brain and the heart and the kidneys and the bones and bone marrow and so forth. Okay, so I'd go for a wider approach there.
Excellent, Doc. Thank you very much.
Well, God bless you and all the great things you do. Thank you, sir.
Thank you, Doc.
All right, thank you, AJ and Dr. Wallach. We've got lots of great comments coming in, and I'm just going to read through a couple of them. So, a lab rat says there is Tesla for electricity, Musk for rockets, and Dr. Joel Wallach for health. There is another comment here that says he is also one who was willing to pay the price for taking on Goliath type power to make them do what is right. So that's coming in from Nancy. I absolutely agree. And then, so we have somebody that's asking for a list of your daily pills, Dr. Wallach. So with your permission, can I put that together?
Yes.
Since I have
Absolutely.
seen it, I'll call you and I'll make sure I haven't forgotten anything, okay?
Okay, thank you.
Oh, you're very welcome. And next, let's go to Morocco, Dr. Wallach. And where to go? Ayubi, and I hope I said that right. Can you unmute yourself?
Yes. Hello, Becca. My name is Ayub.
Ayub. All right.
Yeah. Well, greetings to you all from Morocco. Hey, Dr. Wallach. It's a great day to talk to you. Thank you for all the work you've been doing. I've been following you for quite a while until I got a terrible disc herniation last year. I'm still suffering from it, but I got well taken care of by your team yesterday, sending some recommendations. So I'm impatient to get my products that are on the way. But I want to ask you also on behalf of my mom. She's 74. She's 190 pounds, and she's suffering from terrible pain due to knee arthritis, both knees. She's on blood thinner. She's got some quite slight high blood pressure, and she's got tendinitis in her shoulder. That's also painful for her.
Okay, I'm gonna have to have you help me there, Rebecca. I couldn't hear that. It's too muffled for me.
Okay, so his mom has tendinitis in her shoulder. She has arthritis. Did you say arthritis in her knees?
Right.
And did you say she's 100 and how many pounds?
190.
190.
190 pounds. And I should have taken notes. Did you say she was on a blood thinner?
Yes, and she's 74.
74 years old.
Right.
Does she have blood pressure issues?
Some slight high blood pressure.
And does she have any blood sugar issues?
No.
Fantastic. Okay, so Dr. Wallach, 74 years old, 190 pounds, on a blood thinner with a slightly elevated blood pressure. She also has arthritis in her knee and tendonitis in her shoulder. What would you recommend?
Okay, well, she needs to get rid of all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, no brown rhinos, no buckwheat, no sugar, no carbonated drinks. Even the diet one's got to go. She needs 2 healthy brain and heart packs per month, a full dose of everything twice a day. She needs the I-26 at her age to help rebuild the myelin in the brain and the spinal cord and all the big nerves coming out of the brain. Also needs the Ultimate Daily Classic tablets to have the blood flow through the blocked arteries and veins into the heart, into the kidneys, into the brain. Let's see, where did I miss anything?
What about for the knees and the tendonitis?
Oh, okay, the glucogel. Needs a glucogel to add to that. And she could take 3 of those at breakfast, 3 at lunch, 3 at dinner time. Might take 3 twice a day of the glucogel. I'm the guy who invented it because people got tired of the bone broth. So the glucogel replaces bone broth. And I actually made it for Theo Ratliff, and his career is over because he had so many tendon and ligament problems in his knees and hips and shoulders, couldn't play basketball anymore. So we gave him the rebound and the healthy
And the glucogel.
and the glucogel. Guess what? All his problems went away. He got his job back, and he made over $70 million.
$70 million.
Yep.
Yeah. So I think it was 30 million before he got injured and couldn't play anymore. And then after you got a hold of him, Dr. Wallach, he was able to go on to play and make another 70 million.
Yeah. And he's still going now, running around giving lectures to young basketball teams. We really, really have a high regard for Theo.
Absolutely. Absolutely. So I think you covered it. Oh, except there is collagen, Dr. Wallach, and then also the MSM Ultra. And that helps to support connective tissue, the tendons, the ligaments as well.
Very good. Thank you.
Yeah. So
Thank you so much.
So you are very welcome. You're very welcome. Well, Dr. Wallach, we've got a question. Can we put Jell-O in our orange juice to boost the gelatin? So I know Jell-O has a lot of sugar in it and artificial colors. Would you recommend using Jell-O?
No, I'd go with the glucogel.
Go with the glucogel, or you can do the rebound. Rebound is going to add some extra in there. There's also the collagen peptides, Dr. Wallach. So in the collagen peptides line, there's little pouches that have collagen, a full dose of collagen and a full dose of minerals. I mean, that's a winning combination. And then there's the collagen hair, skin, and nails, which includes the ingredients from the hair, skin, and nails in the capsules with the collagen. And that's a yummy fruit flavored drink that you can use either hot or cold. And then there's also the bone and joint collagen peptides, Dr. Wallach, which I absolutely love because it's giving the extra nutrition for the joints plus the collagen peptides. And one thing that's different about the longevity collagen peptides, it's not just one type of collagen, it's 5 different types of collagen, which helps to support multiple different areas of our body because they're made up of different types and forms of collagen. So I love drinking that one, Dr. Wallach, as a nice warm tea in the evening. And again, that's the bone and joint formula of the collagen peptides, or there's the plain collagen peptides as well, Doc. I put that in my tea and my coffee, especially my coffee. And then there's the collagen creamer. Oh my goodness, there's so many different wonderful things that we have to help support the bones, the joints, the skin, the hair, fingernails, all the above, Doc. So we
Thank
started
you.
out as heart. We've kind of covered the heart, the brain, the bones, the tendons, the ligaments, and we've got one more question coming from South Africa.
Oh, shoot out there.
Albert.
Good evening, Dr. Wallach. How are you?
Okay. Bye, Donkey. What's
Doc.
up? What's the question?
Doc, we've got one of the guests on the show. He's a gentleman. He's an ex-Vietnam war veteran. He weighs 210 pounds. He's 79 years old and he's about 5'9". His specific question tonight is, how can he get rid of plaque out of his arteries?
I'm sorry, how can you get rid of what?
Plaque. He's been told he's got plaque in his arteries.
Plaque, Dr. Wallach.
Oh, plaque in his arteries. Okay.
Plaque.
Okay. Yeah, well, it needs to get rid of all the bad stuff. No fried foods, no processed meats, no oils, no glutens, no wheat, no brown rice, no buckwheat, no sugar, no carbonated drinks. Needs to take 2 of the Healthy Brain and Heart packs per month, a full dose twice a day. Needs the Ultimate Daily Classic tablets. Take 3 of those twice a day. That's going to get the blood flowing through the kidneys, into the heart, into the blood vessels, into the liver, the brain. And as long as he stops creating more bad stuff, all the nutrition will help relieve what's the bad stuff that's there. It'll show benefit within weeks.
And we don't want to forget the Ultimate Niacin Plus, Dr. Wallach.
Okay.
That has the nattokinase in there that helps to clean the blood, open up and promote circulation throughout the whole entire body. And folks, you can look up the nutrients in any of the longevity products on pubmed.gov, and you will find all the benefits. So, I mean, you've got all these benefits and you synergistically mix them together. You've got some amazing formulas, Doc.
Yeah, and of course, again, I take all those at breakfast and again at dinner time. And I do sometimes when I am in a hurry, I might take a third of them at breakfast, a third at lunch, and a third at dinner time. Okay, a third at breakfast, a third at lunch, and a third at dinner time. So, I take.
How would you recommend taking the Niacin Plus?
Okay, well, if you take too much by itself, you'll get hot burning stuff feelings. Okay, and so I take it. I take the Niacin Plus, 1 at breakfast, 1 at dinner time. So I take them, like 8 to 10 hours apart. But that's in addition, okay, to all of our B complex nutrients.
The foundation.
Yeah. Okay. And so there's some niacin in there, but I take the niacin. We have some great niacin tablets, those shiny gray tablets.
Awesome. Did you have any more questions, Albert?
No, I'm done. Thank you very much, Doc.
Oh, bye, donkey. Alles van die beste. Lekker hoor.
Bye, donkey, dokter. Lekker aand vir jou.
Bye, donkey.
All right. And Dr. Wallach, we got one last question, but we got a comment. And Josephine, she's shooting for 120. And we've got Mr. Appleskin wants to know, what do you think about raw milk?
Well, if you know the cow, and so it's not infected with some bugs or something like that. It's we on the farm we used to drink raw milk. We didn't pasteurize; we just drank it. And of course, one of the things I learned on the farm was, we didn't have to have veterinarians out there all the time because we were giving the animals all these vitamins and minerals. And so I started taking the vitamins and minerals myself because I didn't want to be sick like all those kids in school.
Right.
And so I started taking all the stuff that we were giving the animals, and I was taking all the animal vitamins and minerals, and it worked.
So long story short, folks, if you know how the cow is being fed, how they're being taken care of, and the sanitation is going on when the cow is being milked. I mean, I was raised on, well, for many years, not all my life, but many years, we had raw milk.
Yeah.
I had calluses on my fingers to prove it, Doc, as I was one of the milkers. But Yeah, so raw milk is absolute. I love raw milk, Dr. Wallach, and you definitely want to make sure that it is being taken care of once it comes out of the cow, and also the cow itself is being taken care of so that you're getting a healthy product coming from a healthy animal. I agree. Well, Doc, I know you've got to get going, and if we could get the co-hosts on the screen with me. Thank you again, Dr. Wallach, for another fabulous episode of Daily with Doc and Becca. And thank you for giving us the purpose in sharing a message that is helping people around the world.
Thank you, everybody. Team, we are a family, we are a team, and we're going to be around a long time. So I'm sure we're having an impact on the medical profession. Thank you. God bless.
That's our goal, Dr. Wallach. Thank you, thank you, thank you. Everybody, thank you so much for joining us here on Daily with Doc. I cannot do this program without my amazing team and all of the support of those who show up every day in making sure that the program runs smoothly. We have Albert joining us from South Africa as he's helping to let people in. Thank you so much, Albert. We have Ruth Ellen, my executive production manager, helping to make sure that everything runs smoothly. How the show goes to her computer, she adds the graphics, it gets pushed out to the different platforms so that you can enjoy it on your time, day or night. Thank you so much, Ruth Ellen. We have Sherry, who's part of the tech crew, who is putting the things together and everything in line so that it can be pushed out to the different platforms, because there are some platforms that go automatic and other platforms we have to load manually, which brings me to AJ, who is very instrumental in helping to get those programs loaded manually on all the different platforms that he helped to put together the accounts so that we could get this information and meet people where they're at. We also have with us Kaylee. Kaylee is helping us with our social media and helping us to make a bigger impact there, getting the message out and bringing in different things that she's learning in school to help promote the message. So thank you, Kaylee. We also have Marilyn, as she is using her typing skills and putting what you hear into text so you can read, and you can actually take a picture or a screenshot of that and take it to the person that shared this program with you. Tell them thank you for sharing this program, and tell them what you learned about most or what you liked most about the program, and say, hey, this is where I want to get started, or what do I need to get started on a better health journey? We got lots of thanks coming in. Thank you, Donna. Thank you, Ayub. And everybody, thank you for being here and joining us live in the Zoom room. And for all of you that are watching the live stream, share this program. You didn't hear it just to hear it. Go in one ear, out the other. There's so many people hurting in this world. Now that you've heard it, it's your job to be part of the solution. My name is Becca Dukes. Go to dailywithdoc.com. Again, sign up for the email list. If you have questions, you can use the contact there or email us at questions@dailywithdoc.com. Yes, I got that one right. questions@dailywithdoc.com. And if you'd like more information about joining us and being part of the solution, you can also email us at info@dailywithdoc.com. But again, if somebody shared this program with you, they're the person that you need to get back with and say, how can I help? How can I be part of the solution? For those of you who are not working with anybody and you would like to speak with a certified holistic health coach on the phone, you may do so by calling 855-949-3377. Again, that's 855-949-3377. Thank you again, everybody, and have a blessed day and be empowered. Bye for now. Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach.